Hi there. Welcome to the Strategic Advisor Board. I'm Dr. Bruce Rippee, bringing you all things health and wellness. I did a series on sleep, and I found out that sleep apnea was a big question amongst my clients. Remember, my job is to bake wellness into your culture, your business culture. I start with the executives, and then we filter down to all of the people that you serve. So, and you can get in touch with me at the end at my email address, and I'd be happy to consult with you. Let's have an hour conversation and see how we're doing. All right. So, in the wellness world, sleep is extremely important. How you sleep, think, eat, and move is really where everything goes. And when I did the thing on sleep, it was fascinating. Everybody talked about, well, what about sleep apnea? You hear about apnea, these CPAP machines and all of this stuff. So what is sleep apnea? Okay, so generally, sleep apnea means an obstruction in the back of your throat. What happens is your tongue slides back when you sleep. Everything relaxes. And so your tongue slides back when you sleep. When it does that, it has the tendency to occlude the airway. This makes you wake up in the middle of the night, deal with the fact that you cannot breathe, go back to sleep, wake up again. And sometimes it can happen a couple of times a minute. I mean, it really is that obstructed. If you're on your back, you're going to hear things like snoring. Everybody thinks snoring goes through the sinuses and all of that. That is maybe true if you have extreme allergy and those membranes have swollen. Often it has to do more with the back of your throat and your tongue. Your tongue simply occludes the area. So what are the treatments for that? Well, there are advancement devices, mandibular advancement devices, which is basically the old protruding chin. It tries to move, your tongue is attached to the mandible. So if you move the mandible forward, you have a little more room in the back of your throat. I don't agree with these. I think they're a bad idea for almost all of my patients. What I found is that it causes fairly severe TMJ, and that can be horribly problematic. All right. The other thing, and some people they do work for. So if it's something you want to try, please do. I just want you to be careful. There's another one that actually grabs a hold of, it's draconian, right? It grabs a hold of your tongue and pulls it forward. It's literally like this bulb on the end of your mouth, and it pulls your tongue forward and therefore takes pressure off the back of your throat. Remember, that's where all the problems lie. And you wind up not snoring anymore, and you get a little bit better. You get a lot better, actually, airway, but it hurts your tongue, right? So this is not a great idea. So how would you change that if you wanted to help people? Well, you would put a constant pressure of air on the face. And that's what it means. The positive atmospheric pressure that it literally pushes air against somebody's face. You make a seal and you constantly push air. When you try to breathe, you're having help from the outside and you get more air into your lungs. The CO2 switch happens with oxygen, and all of a sudden you're better. And you do get better sleep with these things. You really do. So how do we get the apnea in the first place? Is it we got old? Is that what happened? In some cases, yes. We're not using our voices appropriately. We're not singing. We're not enjoying things. We're not laughing. We're not keeping those muscles and all of those areas strong. We gain a lot of weight. This makes me very unpopular, by the way. But if we gain a lot of weight, it has a tendency to put fat in certain people, quite a bit of fat in your tongue. Believe it or not, your tongue is a muscle that should not be marbleized with fat. But if it is marbleized with fat, it will be bigger, and bigger means occlusion.